Okay, welcome to today's event on Who's Who in Medical Review. To prevent improper payments and protect the Medicare Trust Fund, Medicare contractors operate the medical review program. And medical review under CMS involves a collection of clinical review of medical records, related information, and it's all done to ensure that payment is made only for services that meet all Medicare coverage, coding, billing, and medical necessity requirements. So today's event is going to focus on the who's who in this process. On your screen and in your slide deck is our disclaimer slide, and we have to show you our disclaimer at the start of every event. And basically what our disclaimer says is we prepared this education as a tool to assist you, our provider community. And we prepared it using the most current laws, rules, and regulations as they stand today. But we all know that Medicare changes often, and should Medicare, Centers for Medicare and Medicaid Services decide to change any of the laws, rules, and regulations tomorrow, it's your responsibility as a provider to follow the most current regulations as they stand. So CMS also prohibits you from recording this event. We are recording it for you, and we will post it again to our Encore page within the next 15 business days. My objective for today is that you learn who the various medical review contractors are in the Medicare umbrella and how their reviews may affect you. We're going to accomplish this today by discussing each contractor's role and purpose and how to find the contractors and also how to respond to any requests they may make of you. And this is just an acronyms list. CMS Medicare is full of acronyms. So if I happen to say an acronym that you are not familiar with during the course of this presentation, you can simply refer back to this list or even put it in the chat and Jennifer will answer that for you. So let's start out. Who conducts medical review? So under the Medicare Fee-for-Service program, medical reviews are conducted by Medicare Administrative Contractors, or MACs, and that's us, WPS. We're your MAC. Well, hopefully we're your MAC. It's also conducted by Supplemental Medical Review Contractors, or the SMRC, the Recovery Audit Contractors, or the RACs, and the Comprehensive Error Rate Testing Program. There's also medical review that's done by the ZPIC or UPIC, which focuses more on fraud, waste, and abuse, but we're not going to discuss them today. Now we're going to take a look at each of these contractors separately and discuss a little more about them. So since Medicare's inception in 1966, private health care insurers have processed Medicare claims for Medicare beneficiaries. So originally these entities were known as Part A fiscal intermediaries and Part B carriers. Back in 2003, CMS was directed via Section 911 of the Medicare Prescription Drug and Modernization Act of 2003 to replace the Part A FIs and the Part B carriers with a combined AB Medicare Administrative Contractor, otherwise known as a MAC. So WPS is, and we are a private health care insurer that has been awarded the geographical jurisdictions of J5, which is Nebraska, Iowa, Kansas, Missouri, and our J5 national Part A providers, as well as J8, which is Indiana and Michigan. And we process Medicare Part A and Part B medical claims for Medicare fee-for-service beneficiaries. CMS really relies on a network of MACs to serve as the primary operational contract between the Medicare fee-for-service program and the healthcare providers that are enrolled in the program. So MACs are generally multi-state regional contractors which are responsible for administering both Medicare Part A and Medicare Part B claims. So what do? In a nutshell, MACs perform a plethora of activities, including all of these on your screen. So we process the fee-for-service claims. We make an account for payments. We enroll providers in the Medicare program. We handle reimbursement services and audits, including provider cost reports. We handle your first level appeals or the redetermination. We respond to inquiries. We educate. That's what you're here learning today. We educate on fee-for-service billing and clinical requirements. We also can establish LCDs or local coverage determinations for providers on various services. And we do medical records review of claims. We coordinate with CMS and other fee-for-service contractors when necessary to do things like develop multi-jurisdictional LCDs or multi-jurisdictional education. Currently, there are 12 AB MAC jurisdictions. There are 7 MACs that have been awarded these jurisdictions. I'm going to go out to CMS's site, and I am going to show you on CMS's site, give me just a second, where we can find some information. Let me pull this back into screen. Jennifer, can you verify that we are seeing CMS's site on your screen?
Yes, we are.
All right. All right, so I'm just going to do a quick search because I am a searcher. I think it's the easiest way to get to the things you need, and I am going to look for medical review map. And I'm going to go to who are the MACs. And here is a current map list. So I'm going to look at the AB MAC jurisdiction map. And you'll see here that here's how our country's broken up and the Medicare administrative contractors that cover each of the jurisdictions. So here we are, J5 is Nebraska, Iowa, Kansas, Missouri, but that it also includes our national providers. So we have Part A providers scattered throughout the United States, and in our J8 contract, Indiana and Michigan. So if you're ever wondering if you leave one of our jurisdictions and you go to work somewhere else and you move to Texas because maybe the weather is more conducive to what you like down there, as opposed to Nebraska, and you wonder who your MAC is, you can quite easily just search AB MAC map and you're going to find out it's Novitas. Later in the presentation, we're also going to talk about an interactive map that you can, or interactive map where you can find who all of your review contractors are. All right, so as we go through, we're talking about MACs, and again, we, WPS, are your Medicare administrative contractor for Nebraska, Iowa, Kansas, Missouri, Indiana, and Michigan. All of these slides are linked for you. So we're going to go out to the WPS website, and I just want to show you a few things of interest on our website. So if you are following along with the handout or you want to go searching later, you can actually just hit the control and click on this picture anywhere, and it is automatically hyperlinked for you. but I have WPS's site pulled up, so I am just going to go and open that site for you. So again, as your MAC, it's our responsibility to pay and process your claims, provide education, enroll you in Medicare, do your reimbursement, etc. So I just wanted to give a quick insight of how you can find things on our website. So first, when you go to WPSGHA.com, you're going to land on the homepage, which looks like this. You're going to want to choose a jurisdiction. I'm going to choose J5 MAC Part A because that's just the first one on the list for no other reason but that. So if I am interested in all things training, all things education, you can go to the training center. Hopefully that's where all of you found the information to enroll for today's event. So here's the live events page. Jennifer gave you a link to go quickly right to that. And you can see all our upcoming education is listed on there. And like I said, hopefully you're pretty familiar with that. I did tell you that our today is going to be posted as an encore of today's event. So you can link to the encore events from our page as well. We have a built-in YouTube player. So if you're not allowed to go to the YouTube page, maybe while you're at work, but you are allowed WPS's page, you can watch the video and it just uses the YouTube player in the background, but you're viewing it off of WPS's site. Now, we only leave videos out here for a couple of months, but they're always available on our YouTube page. So if you go to our YouTube page, you can find all the information. And again, you can link there through the YouTube, information as well. There's other YouTube videos that are out there that are not encores that may be of educational interest to you as well. If I go up here to the topic center, you can see we have it broken down into various different topics that may be of interest to you. Medical Review has a site under our topic center. So if you want to know what our medical review department is doing and what types of things are under review with them, choose your jurisdiction and then choose medical review. And you'll see that we have information on various different topics. If it's a targeted probe and educate topic, all the information regarding those is under here. We do do reviews for skilled nursing facilities right now. Every skilled nursing facility in every jurisdiction is subject to probe review. So here's where you can get information about that as well under both of these sites. There's prior authorization services. If you need to have prior authorization of any of these hospital outpatient services, you can find the information here. Back under the training or the topics center, you'll see we also have information on our claims page. So if you're seeking claims information, you can go to our claims site. If it is provider enrollment, how do I get started? How do I get enrolled in Medicare? Maybe you are a physician and you're moving and you need to, make sure you're enrolled with your MAC. Maybe you need provider enrollment information. Maybe you need information on the PACOS system and, the electronic enrollment information. So I'm not going to focus too much more on here, but the other thing on our webpage, and you could see it was on the top of every page that I went to, is this log on information for the secure section of our website. So if you have access to the secure section of our website, this is where you can log in to see beneficiary claim information, to see preventive service information, etc. So that's something you have to have access to but right underneath it on every page is the provider user manual as well. So this login information will appear on any page you go to until which time you log in. But if you need the general information, you know that you don't have to be logged in for that. All right, so as we keep moving on, keep on trucking here, we're going to talk about the next review contractor under CMS. So CMS also contracts with what they call a supplemental medical review contractor, or SMRC. And they contract with them to help lower improper payment rates and to protect the Medicare Trust Fund. The SMRC conducts nationwide medical review of Medicaid and Medicare Part A and B claims, as well as durable medical equipment claims. And they do that to determine whether the claims are following the coverage, coding, payment, and billing requirements. So the focus on medical review may include vulnerabilities that are identified by CMS data analysis. The CERT contractor, or comprehensive error rate testing program, and professional organizations and other federal oversight agencies can also provide data to CMS about various vulnerabilities that they see, and the CMS might then assign that to the SMRC. At the request of CMS, the SMRCs may also carry out other special projects to protect the Medicare Trust Fund. So when I think about the SMRC, I always think of them as special. They're the ones doing the special projects and special, reviews for Medicare, not the standard day-to-day payment processing reviews. So on your slide deck and on is a picture of the SMRC website. And just like the other websites, this one is linked. So I am going to go out, hopefully, to the SMRC website. There we go. And just give you a little show and tell on their website and how you can find information on their website. So the things that are really topics of interest to you are these things that occur across the top of the screen. So let's first look at current projects. What are some of the current projects that the SMRC is focusing on? And you can see they have the project ID over here and the title of the projects over here. So electrocardiography, they're looking at some select codes. You can get some information by going into these, links over here. OIG findings and opioid use disorder treatment services are another thing they're looking at, etc. So these are all some of their active projects that are going on right now. Documentation requests. So if they send you a request for a documentation review, you can go out to their website also and find some information about how do you respond, and is this letter that I got an actual letter from the SMRC? So you can see a sample letter. Does your letter look just like this, or does it contain anything weird? I always say, since medical review entities ask you to send documentation that contains protected health information, if it's somewhere that you don't recognize, go to their website and verify against their website. And it's also not an issue to call their customer service line and just to make sure, if they can get you in touch with whoever sent the request to make sure it is actually a valid request that came from them. So again, documentation requests, and they have information on how to respond to that ADR. So that ADR is going to process in our paying and processing system. So make sure you read all the information about who the requests need to be sent to. And then if you have questions about doing a discussion and education period after a review, you can go on this section and find that information out. So we're not going to focus too much more on that, but again, the SMRC is the supplemental review contractor, and they're the ones that are responsible for special projects. So at any time, you could be subject to getting a review from them. Next on the list is the recovery audit contractor. So the Medicare fee-for-service recovery audit program's mission is to identify and correct Medicare improper payments through the efficient detection and collection of overpayments made on claims of healthcare services provided to Medicare beneficiaries, and also to identify underpayments, so providers that may have been underpaid for a service can get that future proper payment. So recovery auditors cover all of the United States. Again, if you think about them as more of a collection agency, they're the ones out to find the bad debt. So how do the RACs work? What does a recovery audit contractor do? The RACs conduct both complex and automated post-payment reviews. So the reviews happen after you've already been paid for the service. So automated reviews occur at the system level, while complex reviews require qualified individuals to review the medical record. So that's more of the medical review process. In order to obtain the medical record and any supporting documentation, the RAC will issue that documentation request as well. So I said there's a couple of different RACs, so let's talk about who they are and the areas that they cover. Like the Medicare Administrative Contractors, or MACs, the RACs are awarded geographical areas or regions. So Region 1 and 2 are covered by Performant Recovery Incorporated. Region 3 is covered by Cotiviti LLC. J5 is actually part of Region 2, and J8 is part of Region 1, and both then fall under Performant. So as we move on, you can see that Region 4 is also Cotiviti, and Region 5, which includes DME and home health and hospice, that is covered by Performant. So two different RACs, and based on the geographical area. And this map here kind of shows you the breakdown of how they're covered. So let's take a look at the RACs. Remember I said both J5 and J8 are under Performant. However, some of our J5 national may fall under Performant as well. And any of you, may fall under Performant for DDE and home health and hospice. So we're going to look at Performant first. Again, I have this slide hyperlinked for you. Here we go. And I'm going to just select Region 2 here. All right. So under Region 2, I'm going to show you a few things that should be of interest to you. So what are the RACs currently looking at? So if we go to the Region 2 approved issues, you're going to see there's a list here. Now, the RACs have to get permission from CMS to do all of their different types of reviews. So here's all their complex and automated reviews that are currently going on. So there is a review for minimally invasive surgical fusion of the sacroiliac joint. and they're looking for medical necessity and documentation requirements. And you can always click on the details, and it'll show you who these reviews apply to, as well as references for you, etc. All right. Other areas of interest, additional documentation submission instructions. So if you get a request from Iraq, how do you respond? Here's their submission instructions. So again, everyone's website's a little bit different, but they'll actually link you back to the WPS site. And, you know, again, I highly encourage you to go out to your recovery audit contractors and look at what kind of issues they are currently looking at and if those issues apply to you. So moving on, next we're going to talk about Cotiviti, and we're going to go to Cotiviti's site. So because some of our national providers may fall under Cotiviti, I wanted to just bring you out here and kind of give you an idea of what their site looks like. So it's a little bit different than Performance site. So I just chose CMS MAC Region 3 in this, and they have all sorts of contract update information on this page. As you scroll down, you can see it's in date order. But at the bottom of the page, here's where you start getting all of your useful information. How do you submit the documentation? So methods for doing that, and you can open that link. How to use the provider portal. How to submit a discussion request. If you need to update any contact information. And then their approved issues as well. So we knew from Performant that they were looking at this same issue as well. So this is cross-jurisdictional. So multiple recovery audit contractors, which tells me this is a big deal in medical review. So if you perform that type of service in your facility, I would make sure that you are well aware of the information that is available on the RAC's websites as well. So you can make sure if they do happen to pull one of your claims for review, that you have all the information that is needed. All right, so moving on. Finally, this is going to be the last one we're going to discuss, is the CERT contractor. So CMS implemented the comprehensive error rate testing program to measure improper payments in the Medicare fee-for-service program. So CERT is designed to comply with Payment Integrity Information Act of 2019. CERT actually selects a stratified random sample of approximately 50,000 claims submitted to the Part A, Part B Medicare administrative contractors, as well as the DME MACs during each report period. So this sample size, I think they actually just are going to reduce that to 35,000 coming up. But anyway, the sample size allows CMS to calculate a national improper payment error rate. Therefore, that improper payment rate that's calculated from the sample is considered to reflect all claims that are processed by the Medicare fee-for-service programs during the recent period. So the easy way to think of this is the CERT contractor, they request your claims and they do a medical review of your claims, but the error rate that is assessed is on us as your MAC. So if we are not paying and processing your claims right, and CERT, and this is one of the reviews that the CERT contractor happens to be doing, and we are found to not be processing them correctly, then that error rate falls on us. We don't want the error rate. We don't want you to have the errors. So as soon as we know what the CERT contractor is going to start reviewing, we try to jump on that information and provide you education as quick as possible. Now, as with any medical review, if it's post-payment, these claims have already paid and processed. So there's not anything we can do if they pull one that's already paid and processed, but we can provide you education for future knowledge and how to make sure you're documenting things correctly or capturing things correctly on your claims. Because we don't want you to have the error or to have money recouped, and we don't want the error rate either. So when you see us say CERT education, it's important. Again, we don't want you to have the error. We don't want to have the error. Okay, again, I'm going to go out to the CERT website, and their website is called the C3 Hub. And a few things of interest on their website. Here's the documentation request listing. So what they're currently looking at, what they're looking at under DME, what they're looking at under Part A, what they're looking at under Part B. And then again, additional information under the hyperlinks. Well, you have to download the information, but you can get that additional information about that as well. So this is a little hard to see. Let me see if I can make it a little bit bigger on your screen. But it gives a description and description in Spanish as well. So what they're exactly doing under that review. So you can go ahead and link to those and read about them if that's something you're of interest to. They also have sample letters that you can go out and take a peek at as well, and information about the letters. So I do encourage you to go through here and get yourself familiar with the CERT contractor and the CERT review information if you have never been sampled by CERT before. They may have only requested one claim, but that claim, again, from all of those claim reviews that they make, they determine a national paid claim error rate. And therefore, things like automatic audits could go into place based on the CERT contractor's findings. All right. So I said at the beginning, the last thing I wanted to show you is an interactive map on CMS's site. Again, I have this hyperlinked for you. And if you just go into cms.gov and you do a search that just says interactive map, you don't even have to put in review contractor interactive map. You can just say interactive map, and it's going to bring you to this. It'll be one of your options listed. So the nice part about the interactive map, and I mentioned this at the beginning, is it gives you a breakdown of who all your contractors are by the state that you're in. So I simply chose Nebraska, and here's information about my RACs and my home health hospice RAC, who does UPIC information, who my MAC is. So if it's DME, it's going to go to Noridian, but if it's a Medicare administrative contractor for A and B, you're going to come to WPS's site. So this is a nice way to get all of your information in one fell swoop or one easy look. Because if I move from Nebraska and I go down to Texas, I can simply click on Texas and I can see all the information again, who the RAC is, who the DME and home health hospice RAC is, who the UPIC contractor is covering that area, as well as the DME MAC and the Part A, Part B MAC. All right. Waiting for my computer just to catch up. There we go. All right. So this last page here is just some resources to some of the things I discussed today. CMS's site, the CERT hub, the RAC information, and even the SMRC information. So if the link in the handout itself doesn't work, you can use these links as well. All right. So today, we reviewed a lot of information about the various medical review contractors, and I showed you how to find the information about what they're currently reviewing. As I stated at the beginning, my objective for you today was to learn about each of these different medical review contractors that could possibly look at your medical review claim or your Medicare claims. And we really accomplished this today by reviewing who those contractors are and what their role is in the medical review process. We also discussed how you can find these contractors on the CMS site and on their site, and how you can look up what information they're currently reviewing. So at this point, I am going to ask Jennifer if any questions have come into the chat. Jennifer?
There's no questions in the chat right now.
Okay, thank you. That also affords me the opportunity to take a drink real quick. So with no questions in the chat right now, I'm going to move on, but you can still place questions in the chat. All right, I'm going to take one more peek, and I don't see any information in the chat, so I'll give you back a few extra minutes. On behalf of myself and Jennifer, as well as Medical Review, we want to thank you for your participation in today's event. This concludes our webinar, and you may now disconnect.